I'm cancer physical therapy specialist, Dr. Leslie Welke. And today in the recovery room, we're getting a behind the scenes tour of a radiation oncology department with a real live radiation oncologist to demystify and show you what happens here so you're not as afraid of the process. Radiation oncology is really cool. If you haven't seen our video on the linear accelerator, check that one out as well. Let's go meet Dr. Ellen. I am super excited to introduce you to my friend and colleague, radiation oncologist, awesome extraordinaire, Dr. Ellen.
Hello.
Hi, Ellen.
Hi. Good to see you.
How are you?
Welcome.
So, Dr. Ellen is actually going to take us on a tour of the radiation oncology department. Considering you are a new patient, what would you do start to finish? So you've already checked in with the receptionist, and now you've come back. You met the awesome radiation oncologist.
Right.
All right.
So one of our lovely staff members will escort you back here, and we would give you a gown to put on.
Gorgeous.
Yes, and we would instruct you on which clothing articles to remove. It depends on which site we're treating.
So you can leave the rest of your clothes on.
Yes.
That's awesome.
Right.
Okay, then where do we go?
So then.
Oh, so here's your, very important changing
Here's
room.
the changing room, some privacy.
There you go.
And
All
then
right.
we typically ask our patients to
Here's the
place
little
their
locker.
personal items in a locker, and we
Yep.
give you a key with a little bracelet on your
Nice.
hand.
Very
so you don't
good.
lose it.
Okay,
All right, and
then where do we go?
Then when we're ready to start the radiation therapy process, the first thing we do is a radiation therapy simulation.
Where the techs sit, and then that is the planning room. We're going to head on in there.
Right. So this is a CT scanner. We're happy because this is a wide board scanner. So
Lots of extra
we
space.
have lots of extra space, and when we proceed with the planning, we want to fix the body on the table in a reproducible position.
Okay.
So one method to do that is to use something called a backlock immobilization. It starts off looking like something like this, and then voila, through magic,
Oh,
this conforms to the patient.
So that ensures that every time the person lays on the table, they're in the exact same spot. So the
Uh,
radiation goes to the exact same spot where you want it to.
That's right.
Perfect.
So then after this is made, we do a CAT scan in that position, and that's really all the patient has to endure that day.
Okay.
So after the patient leaves the department, all the behind the scenes work starts. One of the first things we do is transfer this information, the data set, to a treatment planning computer system, and we work with a dosimetrist who helps me with a radiation therapy plan. I'm working on a plan today, and this gentleman has a benign but aggressive brain tumor. Now, just to give you your whereabouts on this image, this is a CT image. This gentleman is lying on a table. That's his nose right there, and his ears you can kind of see flopping out here, and these are his nasal passages and nasal sinuses. So as we're coming down, this is his mouth. So as I'm scrolling through, you're gonna see something pop up that's in this pink color. So this pink volume defines the target. So on each slice, I contoured this volume right there. So my target is this pink volume, and I also highlighted organs at risk, such as the brain stem, which is hiding right next to it. And also going up, we would outline his orbits and his optic nerves and his optic chiasm.
So the goal is to hit the pink tumor area and leave everything else alone.
Right. So when we came up with our radiation plan, the dose is this volume right here. So it bends around this brain stem here. When a patient's ready to start radiation therapy, then we escort you into the actual linear accelerator room, or it's also known as the LINAC.
That's what cool people call it.
That's what the cool people call it.
Yeah. So this is actually where the radiation comes out.
That's where it comes out. Now
Okay.
you can't really see very well, but inside here there are leaves. It's called multi-leaf collimation that shapes the beam as it exits the head of the machine.
So you take the information from the planning session and put it in a computer, and then you figure out where that radiation beam needs to go and not go.
Right.
And then you send it to this machine,
which is kind of programmed.
and then those leaves create that shape that
Right.
you designated. So what are the main reasons somebody with cancer would benefit from radiation oncology?
Well, we use radiation therapy in two main delivery forms. One is definitive and one is palliation. So definitive radiation therapy is used to really kill the cancer, eradicate disease.
So that's typically done after surgery.
After surgery, sometimes we do it without surgery. For instance, like a lung cancer. Sometimes we use chemotherapy and radiation as a primary modality and to definitively treat that cancer.
So you can use radiation and chemotherapy at the same time, or you can use them separately. Okay.
Like for instance, in some sarcomas, we treat with radiation first, before surgery even, to try to shrink disease before the operation.
Awesome.
Another way we treat patients is with what we call palliative intent. So that means that we're not trying to kill all the cancer. So palliative intent means that we're trying to alleviate pain, improve performance status, or perhaps slow processes like bleeding or obstruction. A tumor may be obstructing a vital organ, even like an air passage. So we'd use radiation therapy to help that patient breathe.
So if the tumor is not necessarily curable, but it's causing pain in somebody's thigh and they're having trouble walking, or if somebody's got a tumor in their chest area somewhere that's kind of pushing on their airway, that's making it harder to breathe, or it's pushing on a nerve, you can zap the crap out of the thing, make it shrink, and the person's quality of life and function gets a lot better.
Right.
That's cool.
Therapy,
And it's
which is
how
a huge improvement.
people usually get a response for pain relief in days or weeks, isn't
I
it?
would say typically after 5 days. So
Yeah,
between
that's
5
really-
and 10 days.
Really amazing.
I just had a guy today tell me I don't need any pain medicine anymore.
That's
so
cool.
that's great. So he's able to function better around his home.
So why is radiation done on a daily basis over several weeks typically?
So radiation uses the cell cycle to achieve its goals. So every day cells are turning over, and then for the cancer cells, you want to get them in a certain phase of their cell cycle. So every day you're trying to cause damage. Now, the first time you zap a tumor cells, it may just be a little bit nicked that DNA. But the second time, maybe you're going to make a bigger imprint on that nicking to kill the cells. So every day is important to kind of blast away at the DNA to cause the tumor to die.
Very good. And does radiation hurt?
You don't feel a thing. It's like getting a chest x-ray. And you're not radioactive when you leave this room.
Right, that's a big concern of people.
Right.
You don't,
so it passes through you like an x-ray, and you don't bring it home with you.
All right. Very good. Thank you so much.
All right.
That was awesome. I'm Dr. Leslie Walke with Dr. Ellen, signing out from the recovery room. Have a great rest of your day. Exercise like your life depends on it, because it does.
It does.
We'll talk again soon. All right, so let's start here, and then you grab a gown, and then we'll go on. Yeah, okay. And then just walk us through what a typical patient would do. All right. Okay, here we go. Okay, so why don't you come on over here.
Okay.
So I'm going to just start this way, and then I'll turn the camera around.
Okay. You know what? We could go to the changing room. Like we give them a gown.
Oh, sure, that's fun. Look at you being all
Yeah.
directorish and stuff.
Okay.
All right,
Okay.
very cool.